Welcome to Research Perch from the Massage Therapy Foundation. Short, practical insights into massage therapy research and how it can benefit your practice.
Hello, everybody, and welcome to Research Perch. My name is Adrienne Asta, and I have the privilege of serving our industry as the president of the Massage Therapy Foundation. And I'm so excited about today's podcast because we have two exciting guests with us today, Cynthia Price and Megan Sherman. And they are working on a large NIH-funded randomized controlled trial to work with people in treatment for opioid use disorder. And massage therapy is uniquely positioned to help this population. So I'm really thrilled to introduce you to Cynthia and Megan. Cynthia is a research professor at the University of Washington School of Nursing. She got her massage therapy training in 1981 and worked as a massage therapist for 20 years in private practice, during which time she got her master's in counseling psychology. She went on to get her PhD in nursing science in order to study the approach she had developed called mindful awareness in body-oriented therapy, or MABT. MABT is designed to develop an increased capacity and emotion regulation. Cynthia's research is focused in community clinics, and the majority has been with people in treatment for substance use disorder, many of whom have a history of significant interpersonal trauma and/or chronic pain. Cynthia is also the director of the Center of Mindful Body Awareness, through which she and her colleagues offer trainings to body workers and other therapists and healthcare providers in the delivery of MABT. Megan Sherman is a massage therapist and has been in private practice since 2003. She has a master's in psychology and education, spirituality, mind, and body. Megan was hired 2 years ago to work on a study of MABT for people in medication treatment for opioid use disorder and trained in MABT at that time. She also assists with the MABT trainings through the Center for Mindful Body Awareness. Ladies, thank you so much for joining me today and taking time out of your day to talk about this amazing study. So I think where I want to start is with you, Cynthia. I think the biggest question is, what was the origin story of this? So how did you come up with this particular training? What was the need that you wanted to fill?
Oh, originally, by the way, thanks for having us. And originally, this approach came out of my work with women who were in recovery from sexual trauma and were disconnected from their bodies. And so trying to figure out, as a massage therapist, working kind of more in the emotional realms of healing, what they needed to reconnect with their bodies. And so this approach kind of grew out of working with them and learning from that population. Down the road, I was funded to work by NIH to work in substance use disorder treatment. And the majority of people that we work with who are in community treatment for substance use disorder have quite significant trauma histories. So this, sort of the origins of this work and how it fits with this population is quite well matched, actually.
Great. And Megan, you have been practicing bodywork since 2003. So what was your experience prior to the MABT training? And if you could describe to us how it may differ from your treatments prior to learning MABT.
Sure. Thanks so much for having me here as well. Such an honor. So let's see, over the 18 years before my path crossed with this study, my body work trajectory had been all over the map. Deep tissue, structural integration, Esalen massage, shiatsu, ashiatsu. So, I'd been on my own body work learning journey for a long time. And I was getting to a point where I was feeling a little bit of a wall around that nexus of where the emotional body and the physical body meet, and having adequate skills and tools to support people in that place. And there was also a real curiosity for me around the science and feeling like, gosh, like what's going, the really healing parts of the bodywork experience felt like they were not fully represented in the science. So there was that curiosity for me, as well as feeling an urgency around having more folks from all walks of life have access to the kinds of support and nurturance and, healthy touch and well-being that people with means, who get to access massage therapy the majority of the time have. And so there was a real passion for me over time around how do we get this kind of work into community healthcare, and wondering about alternative approaches to working with pain, right? That's what a lot of massage therapists we work on, but realizing there's just this huge need, this gaping need where massage therapists are not quite given access to those kinds of clinical care settings, and the tools that are required to work with people who have these comorbidities and issues. So when this came on along my path, it was just really serendipitous, excuse me. I was starting a master's really with these questions in mind. And I live, in Bellingham, Washington, this tiny, pretty small city. And I caught word of this study happening, and someone, friend of a friend saying, this seems like it's right down your alley, Megan, like you should call this person. And so it just really seemed like, wow, this is happening. This is sort of like just incredible that someone like Dr. Price is doing this work with that background of like knowing what's possible in the clinical bodywork setting, but also having these tools around trauma and working with people in these really sensitive places of disconnection in their body. So it's just been, hugely important in terms of learning how to hold space for people. And I could go on and on, but it's given me, very specific tools. So as opposed to kind of entering this really it can be kind of a scary realm for body workers to work with the emotional body, and having a system that's really been developed over time, has the backing of science, and has, Cynthia and the other folks that she's trained to share this work have a real depth of understanding. And so the training is just very supportive, and it's not sort of a, flipping pancakes kind of go take a weekend workshop. You really feel like you are, developing the skills that help people with these kinds of histories in their body.
Well, that's a great segue, because my next question for you, Cynthia, was, can you give us some bullet points of what the MABT training is like? What are some of the objectives that you meet in this training?
Yeah. I always find that it's a little challenging to do the bullet points and have people follow it sometimes without experiencing it. But the primary goals of what we're doing in an 8-week intervention, which is all that we have for a research project, are to teach people to bring their attention into their body so they're more aware of how they feel inside. That's the overall goal. And we do that in an incremental sort of scaffolded way, where we start with helping people just develop language to articulate what they're aware of in response to massage. So if there's a lot of verbal back and forth, but the beginning process is simply being more aware and being able to identify through language what sensation is in response to touch on the external body. And then we move into helping someone bring their attention internally. So using awareness of breath moving, awareness of softening in the tissue, but from the inside to help people have that awareness come more internally. And so the therapist is very much an educator and a supporter of facilitating the client's capacity to do that. And then lastly is really more the mindfulness component of this work, where we're helping to support the client maintain and sustain attention in very specific internal areas of the body, and notice what happens, develop the capacity to do that, notice what happens when they're able to do that, because their experience of their body will change. So for example, if someone has a lot of anxiety in their belly, and they can bring their attention in their belly and rest their attention there in an open, observational, sort of mindful way of just being present inside with that experience, what they'll notice often is that over time, if you can stay there for a number of minutes, the experience of that space will start to shift. And so the relationship, just knowing that things are not static, they're not stuck, that things can shift, that there's a lot of acceptance that goes on and a reappraisal of, I can actually feel something good in here, or I'm aware of when I really relax a little, my sense of this place in my body changes. And then there's like, well, what's that about? So it's sort of like looking at what comes up for the person in terms of their understanding of their internal experience. And those things get shared verbally as the person recounts what their experience is. And then we try and work with them collaboratively to come up every week with a take-home practice to try and integrate these skills into daily life. So the whole idea is to give people really a new set of somatic and embodied tools for awareness and regulation. And it happens slowly over time. When you have people who are pretty disconnected from their bodies, which we do with the populations we're serving in this study in particular, it's a slow process, and we do what we can, but people tend to make quite big strides in a very short period of time. And I think that's the most important thing that we see over and over again. You can spend more time with people, but even in 8 weeks, we see enormous changes in people's capacity to pay attention, to be aware, to relate to themselves differently, and to feel like their body becomes more a place that's a place you might call home for them versus something that just is uncomfortable, painful, you ignore it, you avoid it, whatever.
We had done a Research Perch podcast with one of our community service grant recipients who works with addicted population. And she had a very powerful phrase by saying, the opposite of addiction is connection. So here, I love the work that you're doing to connect with themselves. And I think often an overlooked benefit of what we do, of just body work in general, is this capacity to be in touch with yourself and to be able to articulate it. One question that comes to mind in this type of work and working with an emotional body is, I think some of the apprehension of our colleagues might be around scope of practice, right? Where does that boundary lie when, because we're body workers, right? So we hear that word body, and then we start getting into our emotional selves and seeing how they intertwine. How do you work with your students who are learning MABT and help to navigate that boundary?
No, it's a great question, and it's one we get all the time. And we're really focused on sensation and present moment sensation. So the verbal pieces that always come back to that. What do you wear right now? How do you feel that in your body? So we're not doing psychotherapy. That doesn't mean that people don't come up with stories about their lives or share things that have an emotional content in the course of the session. That happens in massage therapy. And again, we're working with taking that information and reframing it back to the person and saying, what do you wear right now? So it's the scope of practice piece that's where I make the distinction, is that it's about sensation. It's about what you're experiencing right now. It's not about your story. It's not about analyzing and interpreting your experience from a psychological lens. And I think that distinction works.
Can either of you give me an example when you have been doing this work and maybe a trauma response gets triggered? How have you handled that?
You want to try, Megan?
Sure. Let me think. So really what Cynthia was just alluding to around kind of slowing things down and really inviting people to bring their awareness inside in that moment. So really coming into sensation and helping almost interrupt the story and that part of the mind and the brain that kind of wants to jump in. And what we're often looking for is the different ways that we disconnect from our direct felt experience. So, not that those stories aren't important. And sometimes those like an image or a reference that has an emotional quality will surface, but it's coming usually if we're really, holding the space in the way that we're really working with, it's emerging from that experiential space. And it usually has this really clear quality to it, this very simple body intelligence. And it's, it might be something sort of like what Cynthia said, like some really simple truth, like I'm okay, or, or like I've got this, or like I am worthy. It's some really just deep, very clear, simple statement. So I think when people start to kind of move, we're taught, and we work a lot with really picking up on the signals of disconnection, very, very in this granular way. So we have lots of chances to kind of catch that and slow things down rather than it sort of spiraling into more disconnection and more of that trauma response. So ways that we might do that too is just, backing off of anything that is happening, having folks, open their eyes, feel the table, work with their feet, just kind of those sorts of things. So there's no pushing. There's really a working with people where they're at and using those signals that we're learning and have learned over the years to kind of be so present in our own body, in our own work, that we are tending to those places. We're not overriding when we notice the little bit of the eyes fluttering, or people start to feel, something in their legs, feel cool sensations. That's when we kind of go, okay, so we're taught, and we work with those things in our own bodies, and as we're present with other people. One other thing I feel like is really helpful is that the client is really directing the session. So every moment of the session, we are moving from what they bring forward. We don't have sort of this agenda of goal orientation. So it's really working at the pace of trust. Working with the intake session is really important. It gives us a chance to kind of tune into what's going on and build trust and rapport. And then we work with the body in terms of finding out where they hold tension, where are those spots that might, be a little bit more charged. So it's very scaffolded, so that it feels like, there's no sort of runaway train there, and coming back to that very direct felt experience.
Great. Anything to add to that, Cynthia?
I would just say that I think this is one of the reasons why touch is used in this approach and is so helpful. And we're training people who don't use touch as well in this approach, but I think touch provides an opportunity for a client to, it's the guide for them to kind of come back in the body, right? And so we're constantly helping people remember that through reminding them with our hands, bring your attention right here, right where I'm holding you, and so as whenever there's any sort of increased reactivity, whether it's trauma or whether it's something else, right? It's just helping someone to learn that through touch, and then they can practice on their own with self-touch at home, that you can calm yourself down. And how do you do that? And where in your body is the best place to go for you to do that? And how can you use your breath? And how can you use your awareness? And so these very, very simple, fundamental tools, a lot of these folks don't have it. And so that's a lot of what we're doing in this work, is providing that repetitive training to help someone really get it, that their bodies can be a resource for them for this level of very fundamental regulation and awareness.
So tell me a little bit about the study. Tell me the most exciting thing that you're seeing in this particular study, or anything you've done leading up to this.
Yeah, I think this is the third study that I have done that's been NIH funded with people in substance use disorder. What's different about this study is that it's men and women instead of only women. So we have 50% men, 50% women. What's also different, of course, is they're on medication for opioid use disorder versus an array of substances that they might have been using that brought them to treatment. And what is interesting, because we have now sort of finalized enrollment and we're starting to look at our results, but we are at the point where we can only see sort of who has been in this study. We haven't really looked at the outcomes from treatment. But what's really been striking is two things. One is that we are seeing more people complete this intervention than in any prior study of substance use disorder than we've seen before. So the vast majority, like 80%, are completing the full intervention when they've been assigned to it, which is remarkable for a substance use disorder population. And I think some of that has to do with the fact that these folks are really hungry for more support, that they are not mothers with young children who don't have any time. They're not in an intensive outpatient program that requires them to be at the clinic 3 days a week. Like, they just have more time. So that's participated in that. But I also think it's really an indication, and this was the whole point of doing a study with this group, is of people, they're not getting any other kind of substance use disorder treatment. They're only getting medication. And there's clearly a need for more than that in treatment of opioid use disorder. And the folks are showing up. They clearly appreciate the work, have very, very strong connections with the therapists, feel very supported. Most of the clinics that we're working in are primary care clinics, and not all of them, but most of them. And So they're seeing, they get their primary care, they get their medication for opioid use disorder, and sometimes they're getting their psych care, everything else within the context of this one clinic, and our therapists are working in that clinic. So there's a sense of being able to connect with the team around their care in a more holistic way with this research happening on site. And that's a very powerful experience as well. And because we're working in a lot of these clinics with nurse care model manager programs, we have a lot of connection with the nurses who are sort of the primary caregivers for a lot of these folks. And just seeing how beautifully that interaction is working, and how we can hear things from a client that if they're wanting more support, we can go to the team. And so just really seeing how this work can get incorporated into overall care in a really positive way has also been really exciting to see. There's no question that, just based on what we know anecdotally, but again, we haven't seen the outcomes on our measures yet, that but just from hearing and knowing about their experiences with massage therapists, have been extremely satisfied and have really gotten a lot out of it. Yeah.
What was the literature saying prior to you studying this approach with this population?
Yeah, so the relapse rates for people who go into medication for opioid use disorder are very high. And that is why NIH, and this huge epidemic in terms of opioid use, there was such a focus on, how can we support people staying in treatment? And there had been very, very little study of other kind of additional supports. There had been a couple studies looking at cognitive behavior therapy. It didn't really seem to be that useful. And so there was, this interest by the National Center for Complementary Integrative Medicine for, well, how can we, look at other approaches that might meet the needs of this population and support their treatment more, be useful to look at. So that's what we got funded, right? And other people who are doing similar sorts of alternative therapeutic approaches, particularly mindfulness in the mindfulness realm, got funded. So, we'll see, the jury's out, but I think we're gonna, it's gonna be, my guess, quite clear that these kinds of approaches, whether it's MABT or other kinds of mindfulness-based approaches, or I don't know about other things that are being looked at, but this population needs a lot of support. They've got a lot going on in terms of pain, in terms of trauma, in terms of anxiety, and they're not getting that additional support for their treatment that they need.
If a massage therapist is interested in being trained in the MABT method, how can they find your training?
So we've got a website. The Center for Mindful Body Awareness is a nonprofit, and we have a website, and it lists our trainings. And there's a connect page where someone can sign up to be on the newsletter and hear about those trainings as well. But we welcome people who are interested in learning this kind of work to take our trainings, and we have one coming up in June. And yeah, I think it's really work that people can take. We're training like what Megan's been doing, an 8-week protocol for research, but one can take this work just like anything that you learn as after massage school as an approach and integrate it into what you do. Just weave it in the ways that are appropriate with how you want to work and who you're working with. So that's what we use the protocol as the basis for the training, but we expect people not to do the protocol, but to weave in the skills into their practice.
And Megan, can you reflect for us how you've integrated this work outside of the opioid population?
Absolutely. Yeah. Thanks for that question, because it's really transformed my practice. I had a client the other day say, like, has your practice really changed since you learned this? And I was like, yeah. There's just so many tools, really direct tools that allow people to move into their own practice with themselves. And I feel like that empowerment piece of like, where does the rubber hit the road, where people take what they're experiencing in the massage room and start to integrate it into their lives and giving them something. So many people want tools and some other sorts of, body therapies where they get homework don't always work for them. And so I feel like this provides a niche, like, so for PT, really important work, right? But a lot of people have a hard time doing the exercises, say, right? Whereas I'd say the homework practices and the practices that we're able to integrate into a massage setting are very mobile. They're very transferable to their lives. They're like, these little practices that you can do, right before bed to help you go to sleep, or when you catch a pause when you're, sort of escalating with your child, there are practices you can integrate. And so doing those with people with touch, and then inviting them to do a little bit at home, between this session and next session, checking in on how that went, has been really enriching, I think, for me in my work, to see, give people more to work with in their own lives. But also to hear when they come back and say, hey, my kid who has extreme, ADHD, I did that breath practice with them this morning. Or I did that with them, a number of times, and now they ask for it. Or, I've been doing this thing right before bed, and I've just, my sleep has improved so much. So just things like that have been really transformative. I'm trying to think also for people who are really ready to work with the intersection of their physical and their emotional body. There's some people who are just kind of primed for that, and having, really effective, efficient, concentrated ways for them to do that aren't psychotherapy, where it's really an extension of where they're at, in their awareness of their body, or where they're just at that point where they're ready to take the next step. And I feel like that's been just such a gift, to me, to have something really effective to offer. And then there are people who have really like chronic old pain issues, old habitual holding patterns in their bodies, where, we've tried every which way and it's still happening, right? It's still, and so that's where sometimes I go, hey, you want to try this thing? And I might send them some information about it and say, feel free to like check it out. And, we can talk about whether this is something you want to explore. And so for some people, the pain is the doorway where they go, just doesn't matter what I do, there's this thing, and it's old. It may even be intergenerational, right? Like there's these holding patterns that I think when we're moving into this inner body awareness, it activates something that's just so different than just, what I've learned in lengthening tissue, or even just in meditation. It's like this nexus of the two that seems to kind of give way to something really, really new and different. And sometimes old, like I had one person through the study, I've had other people, but who had really chronic low back pain, like their whole life. They spend a lot of time mitigating that every day. And through the MABT work, they experienced like complete disappearance of this issue, and I don't know how long that happened. I don't get to, I don't have my crystal ball to go, okay, months into the future, did it return? But for the rest of the period that we were working together, it was not there. And it was just, this person was just flabbergasted, like they just couldn't believe it. So, that was like an extreme case, but it was like, hey, sometimes that's the doorway. There's that thing that unlocks something for a person. So
Perfect. Is there anything that I've missed? Any piece that you are burning to tell us? This is such a profound and large, training, in order to really dovetail with what we're already doing. So in my, lack of knowledge of the system or the protocol, the training, am I missing a question that I should be asking you?
About the training itself, or
about the work, about the training, about the study, any piece that you feel is really important for our audience to know that we haven't touched on yet?
I don't know. I mean, I think in terms of the study, we didn't talk. I mean, this was a big study, right? Like we've worked in 5 clinics in Western Washington, and we enrolled over 300 people. And I think I would love to see more opportunities for massage therapists to engage in, like what Megan was talking about earlier, and part of why I do this work is to reach people who otherwise don't have access to it. And, I'm hoping that with a little more research, but I think it's going to take more than that. It's going to take leadership to really promote the integration of these kinds of practices into care. And it's going to take policy changes. It's going to take Medicaid and Medicare coverage for low-income people. And, there's just so much to do. And so I just think, there's so many ways for massage therapists to potentially interface in these different realms, but it's also finding the ways to do it. And it's not always easy. And I'm very aware of that. And, but I'm also aware that the world is way more open than it was 20 years ago when I started on this path, and that there's just a lot more appreciation for body awareness, for the role of having alternative therapies that sometimes, especially low-income folks, feel more open to. They feel like they're not judged in the same way that they've experienced in conventional medicine. And, so I just think, we have to keep, as a profession, our finger on these various things to try, it's a multitude of potential entry points. And whether it's through the work of the foundation, whether it's through the work of schools and programs, whether it's individuals who have connections in clinics, whatever it is, there's, I just think there's so much opportunity and so much work to do to make the world a better place for folks. And I guess that's that's a little more abstract, but it's what I think about a lot with this work is like, what's the point, right? Yeah.
And what is the website where people can go to get information about this training?
It's www.cmbaware.org.
Okay,
but if
great.
you just Google Center for Mindful Body Awareness, you'll find it.
Fantastic. And we'll put it in the notes as well. So people who are listening to this podcast can go ahead and just click on that link. So Dr. Cynthia Price, Megan Sherman, thank you so much for your time. Thank you for the work that you're doing. I'm really excited to see the results from this study. And for more information, you can reach out to us here at the Massage Therapy Foundation, and we will connect you with Dr. Price and Megan. Thank you very much.
Thank you for having us.
thanks so much.
If you enjoyed this podcast, please consider donating to the Massage Therapy Foundation so that we can continue to bring you this and many other resources to increase your knowledge and improve your practice. Thank you.